So, Caryanne, how old are you?
20.
Do you give us permission to do all these sports massage modalities on you?
Yes.
Okay, and we're gonna be working on your ankles, your back, your shoulder, your elbows, and then we're gonna demonstrate some orthos for those.
Okay.
And then we're gonna use these massage cups with oil from the same aroma that we used last time, which was ylang ylang lavender. We'll actually use that on your friend Tila.
Yeah.
Dang, all of you girls look alike. And then we're going to be using this machine right here. It's a handheld one. You can use it like a massage gun to get into any adhesion lesions that we fill.
Okay.
Okay, so if we fill any knots, we're going to do this. Okay, cool. And then these are pelvic blocks. Do you give us permission to put these under your pelvis so that you get more relief in your hips?
Yeah.
Okay, it'll help with your gait and then also with your lower back discomfort.
Okay.
Okay, cool. And then these are instrument-assisted soft tissue mobilization tools, guasha, metal guasha tools. And those are going to be good for the chronic pain inflammation between really dense muscle layers of the tendons that are holding adhesion lesion knots and tension. They can be compressing nerves. It'll just be superficial, it's fast, it's rapid. We did it on Tila's back. Did you see Tila's back and see it left a little bit of petechia?
Yeah.
Okay, it could use that.
Okay.
And are you okay with a little bit of petechia?
Yeah.
Do you know to stay hydrated? Great. And then these can also leave petechia marks for like 2 weeks. Okay, cool. All right. And then here's a massage gun. We might use that today, but everyone kind of knows how to use a massage gun, so we'll do that. I brought my laptop too because I'm going to be, I might want to, hey, what's your Wi-Fi password?
Buddy1234 or Buddy123.
Okay, that's fine. I probably won't even use it. That's fine.
Okay.
Okay, so we're gonna go ahead and do some orthos since we're gonna be working on your ankle and your elbow. Sorry. I almost started. I'm gonna put some rubbing alcohol on my hand, okay? Okay. Actually, while you're getting undressed, we'll do that too, okay?
Okay.
I'll wash your hand. Alright, let's get you on the table.
Okay.
And then okay, so we're gonna do some orthos on your ankle, okay?
Okay. Do you want me to take my sweater off?
Oh no.
Okay.
Wait. Actually, can I get you to get back on top of the covers though?
Yeah.
Sorry, I should have told you that. Oh, I didn't bring my bolster either, huh? Oh, it's okay. Don't worry about it. I'm sure you have a pillow around there somewhere, huh?
Yeah, there's like a bunch on the couch too.
Oh, okay, cool. So let's go ahead and get you to sit right here and put your feet at the edge of the table.
Like dangling?
Yeah. Alright, just like that. And now sit back. Alright, cool. I'm going to see how your ankle is on both sides, okay? I'm just palpating the musculature that's in the structures around your ankle. Okay, so nothing there. There's not that much movement though.
Yeah.
Okay, let's have you turn over onto your abdomen, and then I'm going to look at your heel. Okay. This is for motion. Okay, let's do this one. Okay, that's fine. So we'll work on the tendons to loosen that up. We're gonna work on your Achilles tendon. We'll do some IASTM right there, okay?
Okay.
All right, let's go ahead and have you sit on your back. Good girl. And then I'm gonna look at your shoulder, okay?
Okay.
Let me see your shoulder. I'm just gonna see how it moves. I'm just gonna put it right here. How's that? Okay?
Yeah.
Okay. Okay. Now I'm going to put it right here. Just relax it. Good. Good. Okay, let's see. Let's see if you have any neuropathy, okay?
Okay.
Last time you did have a little bit, right?
I think so, yeah.
I'm just pressing on your shoulder down right here. I'm gonna just have your arm like this. Go ahead and flex everything. All your thumbs and your fingers. And then like this. Does that hurt?
No.
Okay. Now we're gonna extend everything. Anything?
Mm-mm.
Okay. Now we're gonna go here. Okay. 110 degrees. Anything?
Maybe a little bit like in the crevice of my arm.
Oh, okay, that's a pretty teres type thing. Peripheral neuropathy. Okay. Anything in here? We're gonna bend. Alright, we're gonna put your hand on your face. Like this. Anything?
No.
Okay. Pronator teres. So we're gonna use IASTM on your forearm flexors right there, yeah?
Okay.
Let's see on the other side. So remember the last slide. Oh, that was your friend. Caryanne. You guys look so similar. Okay, so we're gonna go ahead and I'm gonna press right here. So flex all your fingers. Okay, now extend. Anything? Okay, now we're gonna put it up and flex all your fingers and extend. Anything?
Maybe a little bit in the crevice stuff.
Oh, okay. And then now let's go. We're gonna press down on the shoulder, extend everything. Sorry, anything?
Just the crevice, yeah.
Oh, okay. This is the extensor and the pronator sheath. So we'll be doing IASTM there, okay?
Okay.
And then let's go ahead and start the massage, yeah?
Okay.
I'm gonna do hot stones on you too, okay?
Okay.
Okay. I wanna do hot stones first, is that okay?
Yeah.
Okay. So, yeah, I'm going to cover the camera right here and then go ahead and just take your shirt off, please.
Okay.
You can go under the covers first and then do it.
Okay.
And then let me know when you're ready.
Okay, you should be good.
Alright, awesome. Okay. So, we do need to get a pillow. I'm going to go.
Okay.
There's a pillow right here too. Can I use it?
Yeah.
Oh, it's a stuffed animal. Is that okay?
Yeah, if you think so.
Okay. It actually works. It's like the size I thought.
I want it at a fair.
Yeah. Oh shit, where did you get this at?
I want it at the LA County Fair.
Oh, cool.
Yeah.
It's freaking awesome. How cute. Are you okay with it touching you?
Yeah.
Alright, cool. Okie dokie, Mrs. Caryanne. Alright, Caryanne, so if you find any knots, I'm going to put rubbing alcohol on you and I'm going to wipe it off and then we're going to use that machine in there, okay?
Okay.
Alright. So I'm going to show you how to do the hot stone massage. The hot stone massage is really good. So I got this for $50 on Amazon. You plug it in and it gets hot.
Oh, really?
At a comfortable level, yeah. Always make sure that you can, you know, touch the stones comfortably though.
Yeah.
Okay. So I got them right here. I'm going to go ahead and keep them near me, so I'm going to put them on the floor near me, okay?
Okay.
And then just to disinfect it, I would go ahead and I would, I'm going to use the oil. Go ahead and take a deep breath in. Inhale there, Mama. Let it relax. Breathe it into your body. Great. And I'm going to rub this on your back. How's it feeling, okay?
Yeah.
Can I get your arms at your side, baby?
Yeah.
Just tuck them back. Thank you. I'm going to Caryanne. Thanks, Caryanne.
Yeah.
How long has your mother been sick, dear?
Just this week, like starting like the end of last week.
Oh.
Maybe Wednesday, Thursday.
I offered to tell Brooke Minnie, but she didn't want it. Is that normal?
Yeah.
Okay. Sorry. I was just making sure. Okay. It's a little warm, so what we do when this happens, We have to cool it off somehow, so I'm gonna put it on this blanket a little bit, because you can do that with the warm. Maybe just transfer the heat. Can you feel the warmth?
Yeah.
Alright, awesome. So we just keep doing that until it's gonna be a comfortable temperature for the body. We're just really trying to make it comfortable. And I'm just digging my palms. It's a little light massage. Is that okay?
Yeah.
Okay. This will help you relax the nervous system. It's gonna heat up the body. It's gonna warm it, which will relax it. Vasodilate capillaries, open up the muscle tissue, the fiber. And we're gonna be able to dig into those muscles. Myofascial. This is great. We're doing it right before the cupping. Yeah?
Yeah.
So now I will leave it as a comfortable temperature. And I can just keep rubbing and take right there. Is that okay? Comfortable?
Yeah.
Okay. Can you see a pink mark? That's not a good thing. Not right away. Not when you touch them. Or if there's a reaction.
Yeah.
So it does lose the body heat pretty. Your body's going to absorb this heat pretty often. If you have someone who's heat sensitive or hypertension or something like that, or on medication that makes them really hot, or not on medication that makes them hot, like someone who's in menopause but not taking estrogen, then I wouldn't recommend using hot stones on them. Okay?
Okay.
You're not, so and they don't recommend it for someone who's pregnant either. Just, yeah, because there's a lot of changes going on in the body. I'm just going to use these stones once. I disinfected my own way at home. We can keep putting them back. I'm going to use the other stone now, okay?
Okay.
I mean, they're both good temperatures. We can use it a lot over. Dang it, something's in here. That's why I wear hair sleeve normally, so I don't get these flyaway hairs.
What happens when you do them?
Yeah, they tickle my face. Eyeball, ears, so a soothing massage. I can't touch my face and ears are off. How's the temperature, okay?
Yeah, good.
You can feel it opening up your muscles, huh?
Yeah.
I'm feeling a little bit of adhesion lesion. I'm going to work on it real soon.
Okay.
But we're going to also use this oil for those cups too, okay? You can keep them going if you want it to last the whole time. Alright. Let me get a couple more stones. Alright. We could do a whole body massage this way.
Really?
Yeah. But we don't have time today.
Yeah.
We're doing all that stuff. We definitely want to get into your ankle bladder here too, okay?
Okay.
We're going to get into your elbows. We're going to do the IASTM on the pelvic thing, okay?
Okay.
But we could use also the hot stones for your forearm flexors, extensors. So we'll probably do that, okay?
Okay.
I want to do an abdomen massage on you too, yeah?
Okay.
That seems to be getting the most hits on my channel.
Really?
Yeah, the abdomen massage video I did.
Interesting.
Yeah, pretty cool, huh?
Yeah.
It's only 6 minutes, I guess. Plus I used the movie theater voice. Alright, so we're feeling the muscles, broad muscles. Relax. Loosen up. Okay. too hot?
No.
If it is too hot, you can always stir it. This way, just take it off and rub it here, okay?
Okay.
Always avoid the bony prominences of the body, okay? You don't want to bruise the fascial line a little bit. Unnecessary inflammatory pro-inflammatory factors. So the massage is not supposed to be painful. Plus it's just painful, huh?
Yeah.
Alright. So we just warmed it up a little bit with some stones. Now I'm going to take our cups. These are just silicone cups. You can get them on Amazon. Like everything I got on Amazon. And we're just going to move through your body, okay? So I'm going to start with the little one, closest to the littlest area. Since she's oiled up, we're just going to glide it. How's that? Is that okay for you?
Yeah.
And it just pulls all the blood. You can see it getting red. Does it hurt?
No.
Does it feel like it's irritating your skin?
No.
If it does, it's not supposed to, okay?
Yeah, no, it doesn't.
That's why we have oil on it, so that it doesn't do that. But there are times that the oil can grow up, and we don't want to make it feel like an injury. But it's a good way to get in between those muscle fibers, the myofascial. We got the scapularis muscle attaching right here on the medial border of the scapula, along with the rhomboid. Those can get really tight and I see they get lengthened and weakened. But what does get tight is your deep neck muscle. And we can just go right here too. But you do want to be careful not to be on the neck when you do this, because the brachial plexus does leave the neck right through there, okay?
Okay.
It's right underneath the traps that it does that. So we're on the trap still. If you're on the trap still, you're good. The traps attaches all the way to the external occipital protuberance at the bottom of the skull right here on Caryanne. Okay. And we'll do the other side too. But right here we have the spine of the scapula right. Let's palpate it real quick. Clavicle, spine, supraspinatus right here. It's responsible for shoulder abduction first 5 degrees, and it's also the most commonly ruptured tendon as it goes under the acromion process, different acromion process shapes, attaching right to the greater tubercle of the humerus. So right here we just get some synovial fluid, blood, and nutrients. Making sure we're moving around, we can move around the shoulder. Oh, did that hurt?
No.
Because I didn't really have that much truth. I only had a little bit of love.
Okay, we'll
Moving
get
on
on
the
the
same side right here is the camera didn't see that side. And then here's the attachment to the scapularis on the scapula. You got the rhomboid minor. Major. Not really over the spine. Into the trap. Find the scapula right here, so we can go over this way. Alright. See this today is right here. Get some circulation. It's going to help with the new technique. Let me just put some more oil on it, okay?
Okay.
You don't actually want to leave it like that because it could roll. Especially for the first week. Sorry. So supraspinatus right here. Let me know at any time if it feels uncomfortable or hurts, okay? And you're underneath the acromion process right here. That's where the supraspinatus goes under the fascia. This way you can lift the arm. So it contracts again. Okay. Okay, and then we got the external rotators. Right in here. We're using overhand pitching support. And for spinatus, right below the spine of the scapula. I'm just going to stick with this little one because you're getting a lot of color flushing right here.
Oh, really?
Yeah, that's good. So the external rotator. So we got the infraspinatus here. Attaches to the left side tubercle, or actually right on the greater tubercle, but lower of the humerus on the back, so that it can contract and externally rotate the shoulder. Then you have the teres minor. It's a little area up here on the lateral side. Also external rotator. Subscapularis, right in here. Sorry. Okay. Gotta be careful with hot stones too. That's why some people don't use them, because they slip with the oil and they've been known to hit people's heads and ears.
Really?
Yeah, luckily it's not from high up above.
Yeah.
So some franchises, they don't like to take the risk. So they just don't offer it. Yeah, I know the subscapularis, it's under the scapula and it attaches right here along the humerus. And you got the so that's an internal rotator, so whenever it contracts, it's going to internally rotate the shoulder. So that's why it's right there. It's actually more on the medial side of the humerus. Okay, nice redness right here. Getting a lot of detox going on at the myofascial level. We don't even have to really use the other ones. They're getting so much action going on. In fact, this cup is going to be good for the forearms too.
Really?
Yeah. All right. Okay, so let me make it even on the side here, okay? Because I didn't actually. I didn't do all this on his side on. You always want to be balanced unless someone doesn't want to work there that needs to compensate or make up for mistakes. Get injury. Yeah, nice flushing color. That's good. This is what you want. And if you leave it on longer, it can leave that petechia, but these marks are not going to stay. And if they do stay, it means that there wasn't enough lubrication and it actually irritated the skin. Like an Indian burn or a carpet burn.
Oh.
That's not cute feeling. So let me make sure there's enough oil. We use oil with these, okay? Okay. Typically, my lotion is like an oil base, so you can use it too, but it just leaves a lot of gunk on the cuffs as well. And really, they say not to do this, but since it's superficial and there's a lot of dense ligaments and tendons over the spine, you can use a little bit of myofascial cupping work, but not directly on the spine. It's really not gonna do anything to the nerves, but they just say that in theory, you know, not to. But I mean, you got the supraspinous ligament, you got the interspinous ligament, you got the intertransversus serous ligament. I mean, there's a lot there. Plus, you got the rotators and the multipitals. The nerves are going to be like at least a centimeter, you know?
Yeah.
This is probably getting all that blood up from that top layer. Maybe. Who knows? I should know, right? But yeah, if you're seeing blood, I mean, there's so many dense layers there. We're just getting some regular massage techniques as well. Let's go for some adhesion lesions. Okay, I got a knot right here. Let's use our machine, yeah? I'm going to be using this tool. Alright, so I'm going to go ahead and use this tool now.
Okay.
And what we're going to do is we're just going to use this little head in here, okay?
Okay.
Let's palpate that tendon. That should be right there. I mean that knot, the adhesion lesion. right here. And make sure you're not on boom. Bit rapid, okay? How's that, okay?
Yeah.
Okay. Okay?
Yeah.
Alright, cool. Right in there. Oh, not on the bone. Let's go on the other side, yeah? I got one right here. Feel that? It went down a little bit.
Yeah.
Okay, cool. Got one right here. I'm gonna go right into the second leg. Okay?
Yeah.
Okay. Oh, by the way, if you ever feel pain right here, that's dual ichioid sharp referred. It could be gallbladder referred pain because they share the same nerve dermatome there. See
Oh,
that?
really?
Yeah, the same spine connect referred. Just so you know. Okay, we're palpating for more. No. There's one right here. We're not going to do this on the neck, okay?
Okay.
I know we have a lot of knots, but everyone does it hard right in here. Oh, I got one right here. Is it okay? Does it feel okay, comfortable?
Yeah.
There's something. I'm just pushing in my fingertips, fat pads of my fingers together to feel pressing. Like I feel like it's just a give. Like you're going to compare it and you're just like, oh, that's tighter than the rest of the adjacent fibers. Because any area that's tighter, it's going to be more prone to tearing and causing more knots and getting bigger and causing more buildup on top of it. Here's that knot again. That's okay?
Yeah.
Okay, cool. TPA is cool. It's really big right now. Structural. Okay, now you're good. Okay. I'll just clean those off with guasha with rubbing alcohol or soap and water for the cups for sure, and then Clorox wipes. So I'm just doing like a finger rush. It's a little bit of kneading, yeah? I like to do this to circulate the fluid. Like I'm running them into each other, 2 legs crashing into each other, and just dispersing all that fluid and tearing it up, yeah? And it is protein molecules byproducts. And you can see she's got some good reaction to the massage or tissue. So ready to be broken up, relaxed, built and repaired with a level. Just digging in the thumb, doing some thumb stripping on the invertebral scapula, lots of traps right in there, lots of knots like to live right in there. We're just scanning for knots. Good. Okay. And you like to go right around the back, right here. Around the lumbar fascia, the lumbar fascia. How's it? Okay?
Yeah.
Okay, cool. Now, I'm going to go ahead and use some of our other instrument assisted tools, okay?
Okay.
Just on your back. So we got a plethora of them right here. We can try this little pointed thing right here.
Okay.
To get into the very tiny knot. Make it cold to the touch, okay? How's that, okay?
Yeah.
And we're just doing fast rapid. Not too deep, because we don't want to hit the bone right here, but it's very close to the bone. So you're going to be worried about the tendon into the myofascial. You can kind of feel it under the metal too. You can feel the bones that aren't bone, you know?
Yeah.
So we'll go to that knot that we found earlier. There's one. Feel that?
Yeah.
We're just gonna pin it down. And do this little thing to help break it up. And the scout's rapid, avoiding the bone, superficial, not really putting too much pressure on it. Is that okay? Mm-hmm. We don't want a lot of friction. Okay. A little bit of pee right here. Oh, here's another one. We're getting your wrong way here. Some of your tracks, upper tracks. Let's see the direction it's going. It's running with the tracks. And the wrong way major. It's more of the tracks, so it's an upper layer muscle. You got it right between the muscle. Myofascial between the wrong way major. So wrong way major goes like this. And your tracks are like this, which is your upper track muscle. So it's in between that fascia line. How's that? Okay?
Yeah.
See, this is more for like pinpoint stuff. Like you have it in your hand. I'm gonna use a different tool, okay?
Okay.
I disinfect this with Clorox wipe as well. So I'm gonna go ahead and use this one because it's a little bit thicker and it might have something we're working with, okay? Put these right here. How's that? It's kind of cold to the touch, huh?
A little bit, yeah.
Sorry. Let me know at any time if it's painful or just uncomfortable, okay? Or if you worry about it freaking instead of muscle. Okay. I'm just putting my finger right on the border where the spine's process is. We're not going to touch the transverse process. We're just working here. We're getting some nice vasculature going. Circulation. Breaking up that myofascial. Flatten it out. Just do that really quick. Getting some skin cells in there too. So make sure you're putting oil on it. Are you feeling okay?
Yeah.
Alright. That's good. Let's use some other ones. This is really good for the legs. You see people using it on the legs all the time. We're going to go ahead and use this one. Looks like it's for the spine or the scapula right in there. How'd that feel?
Yeah, that's fine.
Alright, cool. So we're just putting this between the medial border of the scapula, going through the rhomboid minor, the levator scapulae attached to the superior angle of the scapula. Right here between superior angle and the middle of the medial border is the rhomboid minor. Right here is rhomboid major, medial border, down to the inferior angle. Inferior angle is the teres major, right here. And then you got the teres minor. And then go across. Watch for those bony areas. You see a chromium right there? How's that? Is it okay?
Yeah.
So we'll just do this real lightly. We're not touching the actual spinous process though. Are you good?
Yeah.
Looks like it was made just for reaching around the dense layers of tissue around the bony processes. Nice pink color. I have biofreeze if you want it.
Okay.
Do you want it?
It doesn't really matter.
Okay. Because it doesn't hurt?
Yeah, I just didn't see.
Okay. It's really dense right here. So we're going to work in there a little bit more. Not hitting the bony process, still superficial. Just slightly scraping, rapidly moving the tool on an oiled surface. Good?
Mm-hmm.
I love sushi. That's how you remember the iliac right in here, the longissimus, the long leg, and the semicinalis right next to the spinous processes for the erector spinae muscles. Deep to the lats and the traps and the rhomboids. And then they lay on top of the multifidus and rotatoris that are more inner to the spine. Attaching to the transverse processes. And the other side is the spine. So like when they contract, they actually turn your body the opposite way.
Really?
Yeah, for the multifidus, yep, and the rotatoris. The lumbar spine have mammillary processes that those attach to. So that's when they would do a contact on it to correct for a rotation restriction opposite the positions standing. I learned that in my continuing education adjustment courses, yeah. I'm not hitting any ribs. If I am, let me know, okay?
Oh.
This is almost like it's made for the ribs too.
Oh.
For those that have a lot of dense tissue between the rib layers, it's really good to just get in there because you got the intercostal thing. You're good though, Bailey.
Okay.
Are you good?
Yeah.
Okay, cool. Here's the floating ribs. Cool, cool. Got a little bit of tension right here. Have you been having back problems?
Usually from sitting, yeah.
Oh, and we can use this flat edge right here. It's not really flat, but it's like kind of curved. And just move it gliding along the muscle with this oil. It glides nicely on the surface. How's that feel, okay?
Yeah.
Awesome. That's gonna help relieve any nerve compression below. And then we're gonna do the same thing here. Right on the acromion process. I like the flat edge better. What do you think?
Yeah, cool.
Even though the other edge is meant for those areas. Okay. Cool. Now we'll just leave a couple. We'll do some more. Let me do some more hot ones, yeah?
Okay.
Okay. Still kind of hot, so I'm just gonna. It's a good way to relax. Little muscle, nervous system. I'm just using some flat finger pressure and palm pressure. You feel it?
Yeah.
Okay, good. Eventually, I'm still on. No, it's really a little bit too warm. So and then we're going to get into your forearm, yeah?
Okay.
Cool. Oh, I want to do the sports one on your IT band, yeah?
Okay.
It's similar to the prenatal side, okay? Is that okay?
Yeah.
Okay, cool. So I'll be using this pillow, is that okay? Oh, is that hot?
No, I just scared me. I didn't know.
That was hot, baby.
No, it wasn't that hot.
Sorry. You always want to be careful of that, too. You can feel it too, it's a little hot. I'm just going to take it, but luckily it didn't burn her.
No, it's not that bad.
Because, you know, some people like it to be pretty warm onto their skin. But I can tell Bailey kind of runs a little hot already. I mean, Caryanne. Caryanne runs a little hot. You don't know me anymore, Caryanne. How have you ever met me? You never met
I know someone in there.
Oh. I'm just thumb stripping, following the stair. You can actually leave it right there if you want. It's not too hot, right?
No.
You took all the heat out of it. And then we move on to your hamstring. Actually, we're going to do your calf, okay? Look up the body rest. Is it okay?
Yeah, no, it's really not that bad. It just shocks me every time.
Sorry, it shouldn't do that though. I thought it was ready. And you can always move it fast where I want to go.
Okay, you guys got a lot of sour cream.
Is that for cheesecake?
Cheesecake and the pie and also the cornbread casserole.
The pomegranate casserole.
Cornbread.
Cornbread. Is that too hot?
No.
Let me know because it still has heat from the center.
No,
If it gets
yeah.
too hot, just let me know, alright?
Mhm.
That's just always like this. Alright. Actually, I'm going to take this off here because it might get too hot, okay? Alright. Close this. So for the hot stone, they have different ways of doing it if you were in a clinic. I know someone would like to leave it on the spine to relax the body and moisture your feet. Or cover it with a towel.
Yeah.
But they actually put it on the towel and cover it. But you just cover it. Actually, let's go ahead and work on the forearm, okay?
Okay.
So we're gonna, this one is the one that the extensors and the flexor tendon sheath.
Yeah.
Okay. So we're gonna do instrument assisted soft tissue mobilization. We're gonna do some massage first, okay?
Okay.
Does that hurt?
No.
Or if there's too much pressure, just let me know.
Mhm.
I'm just doing a knuckle stripping. It's the pinky side, so this is going to be your flexor tendons, flexor muscles. They attach to the inner elbow right there when you're in the anatomical position, which is palms forward. I'm getting into that pronator teres compression of the median nerve, because that's where you felt it on the upper limb tension test for the median nerve in median nerve line, which is anterior interosseous nerve. The other one above the head, you didn't feel it. That was median nerve, but that was for the carpal tunnel. Or above the shoulder. Okay. Since it's more difficult to get big sensors here, I just like to get my finger fat pads and just dig in with my finger fat pads. Little circles. Along the extensor muscle and tendon sheath, That is the side that the thumb is on. Attaches to the outer elbow in anatomical position. And the hands are palm forward. They're pretty tight. Is the pain, is it okay?
Yeah.
I also like to just take the arm and I'll just grab it right here with finger fat pad and strip it with my finger fat pad. I'm sorry, I got a little wound right there. How are you feeling? Is that okay?
Yeah.
And you can just stay in that dense tissue area right there where all the knots are. Because that's also where she can get the entrapment that she felt in the extensor band. The tunnel of Frosch, or the radial nerve, posterior and osseous nerve. That's an extensor. She's been doing a lot of baking and cards.
Yeah.
With her pens and rubbing all that dough together, right? Stirring all that flour.
Yeah.
That can be like a lot of work. A lot of flexor and extensor. One on one. Okay, and then I'm going to get into it. Let me do a massage of your hand, okay? So I do want to do your IT bands. Yeah. So I probably don't really need to have you side lying. But I do have a pillow here. I'm going to just put that into your knee, okay?
Got it.
I'm going to use one of the instrument assisted tools to do that too, yeah?
Yeah.
Okay, cool. Thanks, Caryanne. Caryanne's so cool. Like coughing right there, you feel that?
Yeah.
It's just a little bit of inflammation. Your flexors right there. The ulnar side. Remember the ulnar nerve? These two fingers, pinky and ring finger. Radial nerve is the back side of this. Half of this finger on the ring finger side is the ulnar nerve. Half on the median side is the median nerve. The median nerve is index and thumb. Carpal tunnel right here, median nerve right there. The ulnar nerve goes right through here under the hook of the hamate. So follow these two fingers. Radial nerve is from behind. Nice slide there. Okay, let me go get this one. This one's actually pretty nice. It's the one that looks like it's for the ribs. I'm gonna sit on the table. I didn't want to shock you with that, okay? Just so I can get in there. How's that? Is that okay?
Yeah.
So because I boiled it up, I'm just going to rapidly go up right here. Because it's the pinky side, this is where golfer's elbow could be, which is medial epicondylitis. This tendon sheath right there. Little micro tears in the tendon that don't feel over time. Like it's just like funny. How's that? Is that okay?
Yeah.
She's trying to step it on the bone. Alright. You got a lot of inflammation there because it's not really doing anything. It's not flushing right now. So it's okay. Now I'm going to look into your extensor sheet. So I'll just have your arm like this. I'm going to bring it down, get another position. For ergonomics, you can just have your arm like this, okay? This is your flexor sheet. Oh, actually, this is your extensor sheet, the X of the thumb. Side. I was already on your foot. And this is going to be the lateral epicondylitis. The other was medial epicondylitis. Did I say that? No. Okay, if I got it mixed up, no. This is the thumb side right here, so we're on the lateral epicondylitis. Anatomical position is palms forward. This is considered lateral epicondylitis, that's intense elbow. The other one was medial epicondylitis, seen in golfer's elbow. Rapid superficial right along the tendons. Tendons in the muscle, right there. Does it hurt?
No, I heard it on my face.
Oh, okay. You can get in here, right on the ulnar bone, where the muscle is. You can grab a little bit of tissue. Right on the thumb side, grab tissue. up. Does it hurt?
No.
Alright. Cool. And we'll just do a little bit of kneading with the finger and thumb factor. Squeeze it together. Do a little hand massage. We're not going to use the last ones on this, okay? We'll probably use it on the calves, okay?
Okay.
Cool. Do a little wrist action. Great. Do the same thing with the other side. How's your arms, okay?
Yeah.
Okay. I'm gonna put oil on it. How's your back, okay?
Yeah.
Let's see. And there's not really any marks, still a little pinkness right there. And a little pink right there, that's gonna go away. Skin abrasion, that's good. A little bit right there. Check on that. Do our knuckle stripping first. How's that pressure? Is it okay?
Yeah.
Great, we're just right into the flexor tendons because we're on the pinky side. I like to hold the fingers down because they like to move. Because I'm forcing them into contraction. And that forces the fingers into flexion. Along the flexion machine. Alright, now we're going to do some finger fat patch dripping of the extensor sheath. How's that? Is okay?
Yeah.
Let me know if it's too much pressure, alright?
Okay.
Poor kid, you're always getting hurt. Look at all those scars.
I know.
Feeling for adhesion lesions? I got a couple right here. Feel that?
Yeah.
Right there, it's kind of tight. Got one right here. Yeah, that's like your extensor radialis brevis. Brevis longus. Carpi radial. Extensor carpi radialis brevis and longus. Okay. Right in there. Alright. Now we're going to go ahead and start some scraping, avoiding the bones. Oh, I didn't do a hand massage, did I? We'll get to that. Right in the flexor tendon sheath, pinky side, not running into the elbow, but close to it. Fast, rapid, smooth, oil gliding strokes with our metal guasha tool. And then we can use long strokes up. How is it? Is it okay?
Yeah.
And we'll use the flat side too. How's the flat side? Okay?
Yeah.
You can feel every little tight muscle band that's superficial. Moving with it. Okay, cool. Now we're gonna go right here. This. Just rest it right there. Good. Now we just hold down like this. More into the extensor sheath. Thumb side. Right on the tendon, not touching the elbow. Close to it. This is gonna help. Lateral epicondylitis, also known as tennis coil. Yours are tight.
Really?
Yeah. All that baking you've been doing.
Yeah.
And we're just doing finger fat pad stripping. Right, digging into it. Not digging our nails. Even if you think you don't have nails, you can also lay out nails, but that moves your tissue with the client. If there's nails there, it will splash them. Yeah, that's pretty tight. Okay. Let's go over massage. We'll go finger patch massage. Head finger patch massage. How's that, okay?
Yeah.
A little bit lighter stroke. Move stuff around. Especially disrupting nerve fibers if it was pain. Knuckle stripping. Oh, wow. Flexors. Are you hydrated, Bailey?
Yeah.
You want some water?
I'm okay right now.
Okay. Just massaging the hand, stripping that flat palm surface, fingers to wrist, getting into the dense tissue. It helps move around synovial fluid under all of those. Bam, the tendons, the pads and the dabs. Do you know what that stands for? It's actually for the fingers, but yeah, it's for the pennate and multi-pennate. Double, I guess, diamond. Yeah, because those are the ones that put the fingers together and then extend them. I don't exactly remember the detail. But I can look it up.
That's true.
Really, I don't know, mnemonic list, mnemonic list. Any compression on the nerve, any fluid and fluid between the bands, even other ligaments, tendinous dysfunctions, like trigger finger, which can happen. When people talk to them.
Yeah.
And don't take breaks and let all that scar tissue build on top of it. What happens is they end up like this, and they have to pull their finger out, and you'll hear it pop. Pop. Yeah, because they run out of synovial fluid, and there's like, it's not a muscle, it's like a deep tendon, you know?
Yeah.
Ligament. It's in there. It's like synovial fluid that it needs to be in there, so that's how it helps with that. All right, let's test the wrist down. No clone is great. Awesome. Let's do a little bit of compression on the back. How are you feeling? Okay?
Yeah.
Ready for us to work on your legs?
Yeah.
Cool. All right, let's just carry in. Your vantage right view properly. Work on that IT band. We're going to use our great fancy instruments. This is metal guasha tool too. Are you okay with that?
Yeah.
I know you don't really remember, but I just want to make sure. Great. And then we'll just secure it. We're going to do a little massage first.
Okay.
Tuck that, okay. And so I'm going to go ahead and get some hot stone. Get one hot stone, okay?
Okay.
We're going to do instrument assisted soft tissue. Alright, so you're going to your ankle, okay? You just oil. I have more oil too, so don't worry if this one runs out, okay?
Okay.
So I can't take your sock off?
You can.
Oh no, I really can't, not as a massage therapist. So I'm going to put your foot right here and then you can take it off. Sorry, thank you. Okay, great, perfect. You good?
Yeah.
Are you falling asleep?
Feet are just ticklish.
Oh, that's right. They are. Oh, they're so ticklish.
I don't know why. I thought it would stop at one point.
It's okay. It might later on. Oh god, that's really hot. We can put it on the tail. It's not gonna burn through. Is that someone actually talking or is that the TV?
I think that's what you do.
Oh, okay. It's just like Brooke.
I know, right? I kind of hear that.
I'm just putting some deep palm pressure. You feel that?
Yeah.
Being flat finger pressure, palm pressure, just running right into the long muscles of the semi. These are the biceps femoris right here in the hamstring. You got your AT band right here, your little tibial band, and then subtract tendinous tissue from the tensor fasciae latae down here to the residual. Semimembranosus tendinous and the gracilis attached below the knee on the pezon serratus, where these little things are right here on the tibia. Did you feel that?
Yeah.
That is the medial head of the hamstring. Divides right here at the adductor is where the sciatic nerve splits, column fibularis, wraps around under the fibula bone right here, supplies the outer edge of the foot. Common tibula down here, the deep tibial nerve. Interesting, huh?
That is.
So interesting. The calf right here, this is where deep vein thrombosis, the platelets can communicate and conglomerate.
Yeah.
You don't have that. If you saw a bunch of tortuous veins, spider-like twisting veins, spider veins, then it could be a sign there's a platelet problem, a valve disorder in the vein, and there's possibly a thrombus in there. You would not massage that calf,
No.
especially if there's pain. You know why. Okay, I just added the stone houses, okay?
Yeah.
So we're going in long strokes as close as we can, and this is the origin to the insertion. We're going insertion to origin, up towards the heart along the long muscle fibers, the direction they run. Semimembranosus, tendinosus, biceps femoris, lateral head of the hamstring, iliotibial band, vastus lateralis of the quads right there. You're going to do the gastroc right here, right down the middle. Lateral head of the gastroc and the soleus. Medial head of the gastroc and the soleus deeper to that. Ready? How the heat on your plants are?
That's good. Not bad.
Alright, let's palpate. We're going to do the ankles first, okay?
Okay.
See if there's any kind of scar tissue here. Okay, you got the ATFL right around this lateral malleolus. This is part of your fibula right here. Taxon, the talus, ankle mortise joint made by the malleolus. Tibia malleolus on the medial side, deltoid ligament, thick band, difficult to break unless you invert your ankle and break it.
Okay.
Yeah, a lot of trauma.
Really?
Yeah, you have to have a lot of trauma to break this one right here. Most people actually involve the ATFL ligament right here, which is the anterior tibiofibular ligament right here, in an inversion ankle sprain, and they don't really break it. You would have to be hit like any version, you know?
Yeah.
Boom. Yeah. It would take a lot of trauma. High impact sports could do it. Alright, so we are going to ensure an assistant tissue soft mobilization in that area right there. Let's see if we can get a different tool. Okay, I think I'm going to use this one.
Okay.
It's going to be a little colder first, okay? How is that? I'm not digging in, I'm just letting it glide right along the tendons and ligaments. Here's the deltoid ligament right here, just to get a circulation in some of those, but we don't really spend a lot of time now. Right in here, muscle bellies. You're gonna have like your, between the tibia and the fibula, deep in there is the posterior tibialis. Deep in there. Very deep. Okay, yeah, so this is perfect. Look, the gastroc head's right here.
Yeah.
This is great. The lateral side, we're not really digging. We're just superficial still. And then medial head. You don't want to do scraping though if they have signs of vasculature like redness, heat, swelling, venous clots. And you don't have any of those.
Yeah.
But you definitely don't want to use instrument system on that. Because it already has a tissue circulation problem. It would just leak out lung as well. Possibly bruise. Right on the Achilles right here. Achilles attachment. The gastroc and the plantaris muscle attached to this thick band right here. And we can just lightly, it's not really oiled up very much. Add a little bit of oil. And I'm just gonna lightly scrape on it. Do you feel that?
Yeah.
Okay. I'm just going around the edges right here. Slowly control, fast control our rapid small movements. How is it okay?
Yeah.
ATFO. Usually it's very lax in people, so it really doesn't need any more loosening. But up here it would be tight. Right here at the foot, the plantar. Does that tickle?
A little bit.
Oh, sorry. What about the flat end?
Not too bad.
Alright, cool. So scrapey. It tickled? Oh, sorry.
Sore hand.
Poor Caryanne. Alright, Caryanne, we're going to pick that tool up. Now we're going to work into your IT band. Ready?
Yeah.
This could be an area that's really sensitive or hyposensitive and chronic long distance runners.
Really?
Yeah. How is that feeling? Is that okay for you?
Yeah, that's fine.
So I'm going to put this little under this right here, just so it elevates your leg a little more. Give you some modesty. And then we're just going to roll this up some, okay?
Okay.
Actually, lift your leg up a tiny bit. Somehow. Okay, there you go. Okay, we'll tuck it right here. Roll it. You want it as close to this head of the femur as possible. And then tuck. All right. Are you comfortable?
Yeah.
Okay, great. Oh, I thought my nose were all. Okay, so I'm just doing some fat finger pad kneading just to get circulation in there and desensitize the nerves or get them ready for deeper work, because it's not an area that gets a lot of work. It's tender. Yeah, it's tender in people who don't have a lot of work done here. We can start with some finger stripping. I feel quite a bit of bands. There. And right up to the FHA femoral acetabular joint. Here we got the greater trochanter, all the external hip muscles are here. You got your, except for your glute minimus, but your glute medius, maximus, superior joint, inferior joint, obturator, internus, and quadratus femoris, and piriformis, the big one, because when that one's tight, your sciatic nerve can get compressed. So that is right in there. Greater trochanter femur. Pressure's getting a little bit deep. How does it feel? Is it okay?
Yeah, it's okay.
All right. Some people it's tender. I'm not trying to give you pain, okay?
No.
So we're going from, this isn't really the insertion, but that's close before it attaches at the knee. And it's going to attach right in here, like a T-bone. It's a broad, thick sheath. It's not really highly vascular. Deeper work can feel painful. And you won't really get a bruise here because it's not as vascular. Because you got your femoral vein and artery that run together, and they're more deeper to these big quad muscles right here and more internally. So that's the most, and then the little branches off the femoral nerve. That's the main pipeline. See blood into and out of these tissues right here. Alright, I'm going to dig a little deeper.
Okay.
I just want to illustrate how tender it can get, okay? Compared to the hamstrings.
Okay.
Tell me when it's too much. I'm doing like a firm, I'm doing a deep thumb stripping. This is considered deep pressure because I'm taking my time with it. Letting it go through all the fibers. We're seeing the leg shake a little bit. Is that hurting?
No, not really.
Oh, okay, good. You probably just have really dense bands. Don't worry, you're not going to get any bruises here.
Okay.
Let's desensitize her again. Some finger fat pad, knee petrissage, a little bit of knee, rub that into each other. Awesome. Now we're gonna get the long, cool looking tool.
Okay.
It's like a giant scraping tool, okay? It's just for this. Alright, let's put some oil on it though. We'll lay this right here. It's really good too if you have a tight hamstring or quads, okay?
Really?
Yeah. Do you work out your quads?
I'm
Is that
trying
okay?
to. Yeah, it's fine.
Okay, and we're just going to do it fast. We're not digging in because we're not trying to hurt, okay? We're getting some blood flow. See, it's not even that vascularized that we're doing it.
Huh.
And put a little bit more pressure. Just scraping it up. Not hitting the thumb. Still on soft tissue. And then we can get into the just leaning in. You can put it this way to get into the quads. Feel that?
Yeah.
Now you can bruise on the quads. And I got a flat way like this. You can just mix it up a little bit. As long as you can control it too. You don't want this to go out of control. And then, so right here, it's like a hamstring attachment to the ischial tuberosity where the hamstring is attached. It's really good, prevents hamstring strains if you decide to sprint one day. Whatever. Okay, T-band. Got this around this. Quad. A little bit of that V and move. Fastest medialis or focus. Sounds really cool when you say V and O.
Yeah, it does.
I'm a power lifter. I'm doing my RDLs. Hitting a PR. Alright, cool. Pretty good?
Yeah.
Great, we're gonna put you right back. Awesome. We're gonna do the other leg now.
Okay.
Cool, we still got your abdomen to do too.
Okay.
Do some compressions to end it. What's it feel like?
It feels better. Like it feels,
Oh, okay.
I don't know how to explain
What
it.
does the scraping feel like when you first have it?
It's not too bad. It feels like, what's that comparing it to?
That's okay. It's hard to describe certain things, huh?
Yeah, it is.
That's okay. Alright, talk with modesty. 360. And here, take that excess, tuck it under, fingers pointing down. And under this abdomen, great. Triflex. Covered. I'm gonna get this hot stone over here. Okay. It's not that hot. That's good. Oh, can I get you to take your sock off?
Yeah.
Perfect. You can give me your sock. Thanks.
Sure.
Super awesome. And then we got the calves here, gastrocs, you got the plantar. Is this foot ticklish too?
This one feels less ticklish for some reason.
Awesome. So we got the IT band attaches right here. Gonna go up to the FA joint. FAJ. Right there. The gluteus attaches to it. It's just a waddling tendon sheath for flexion and extension of the knee at the hip. Alright, because it crosses the knee on the left side. Got the hamstrings right here. Deeper adductors. Oh, that's what I wanted to do. Sure. The adductors. That's okay. We had it in the prenatal massage.
Okay.
So we got the biceps femoris here. Common, the sciatic nerve goes here. This is the adductus right here. Common adductor. The sciatic nerve splits. Common fibula, right? Common fibular nerve right under this head of the fibula, or wraps under it. Supplies the outer leg, foot. Right here, it splits deep into the tibial nerve and outer branches. Supplies back of the foot. Also, I believe the top of the foot has some branches because I mean it's really the only nerve that supplies some motor functions. L2, L3, 4 femoral nerve for the front though, okay? For your quads. Cool. So we're just doing some knuckle stripping, thumb stripping, right in there, deep in the hamstring. Right here, pes serratus, medial side of the tibia, on here, medial side of the tuberosity, pes serratus, called Sargent, SVT, semi-tendinosus, gracilis, and semi-nephrodesis muscles, right in there. That's that head. Doing some thumb stripping. 3 to 6 to 12 of these, depending on time and how you feel. Knuckle stripping. You do just that. You don't want to irritate that whole band. So it's good to just move strip to strip. You won't necessarily be on the same muscle, but it's going towards the heart, so it's relaxing. And the medial. Reverse it like a mirror. Go lateral, reverse it, go up, work around the joint capsule of the FAJ, femoral acetabular joint, bring it down, get that synovial fluid, that circumflex arteries, that area right there, and then feel for knots as well, and these limbs. If you're a sprinter, you'd probably have them.
Not?
Yeah, in your hamstrings. And then you're gonna go to, okay, this is getting pretty warm. So now we're gonna use this hot stone. We're gonna let it cool for a while. Okay. I think it's good. What do you think?
Oh yeah, it's not bad.
Okay. It's too hot, let me know. I'm moving it fast too. Right along the wall, the tube of the belly of the muscle. Relaxing, right?
Yeah.
You just feel your muscles soak up the heat from the stone, huh?
Yeah.
Now you can turn it over, there's a little bit more heat. Go all the way, avoid this popliteal of the knee. That's what people get bursitis. And it's called Baker's cyst. Yeah, it's fluid going in the knee.
Huh.
There's a little pocket there you can hide. So if it doesn't get to go to hydrating the joint capsules around the medial and the lateral menisci, or the tibiofemoral joint or tibiofemoral joint, then it gets trapped right there. Also from injury. Okay. That's so interesting, right? Now we're working on the foot, just digging in there with some thumb stripping right along the plantar. Heel the toes. Opposite way. Still thumb stripping. How's that feel? Pretty good?
Yeah.
Awesome. Okay, now we're gonna go ahead and have you, hold on. Here, let's irritate my ear right now. We're gonna palpate your ankle too, on this side.
Oh.
Because we did instrument assisted on this ankle, let's do the same on this one, okay?
Okay.
We're just feeling for adhesion lesions, tight spots, restrictions. Got a lot of inversion. A little bit of eversion, that's normal. Because you have some eversion, so that's good. Dorsiflexion good. Flexion's good. No pain, right?
No.
Okay. If there was pain, that would mean she has a ligament tear because that was a passive range of motion. I just went and took her ankle. If there's an active range of motion, it means it's a muscular tendinous injury. Straight up. Yeah. If there's pain. If you're actively doing that yourself and there's pain, it would mean it's muscular. Which is better than ligamentous. It's
Yeah.
you heal faster, that's for sure. Okay, let's go get that. No, one of the tools. Let us know if we're hurting.
Oh.
We're gonna get right into that Achilles, okay?
Okay.
Gastroc, soleus, and the plantar is attached here. Plantar is deeper, and actually goes under rates. And here for the plantar flexion. And it contracts its lower, so it contracts the plantar flexion as well. It's a weird angle though. Not your typical. Huh? Okay. Now I'm just moving along the Achilles lightly. I'm not using my curved angle. I'm just bringing circulation in. Sometimes this gets really tight. Anything really tight makes everything else next to it weaker. All the muscle fibers weaker next to it. So I don't want it too tight. So that makes it weaker. It's more prone to rupture and break, tear. Now I'm using this same side. How's that? Is it okay?
Yeah.
I'm not digging in, I'm just rubbing it on the oil surface. And it's helping to bring circulation there. Okay, now we're going to go into the deltoid right under the medial malleolus. This is part of the tibia, attaching to the talus bone right here, making the ankle mortise joint, which is like this. The lateral malleolus, ATFO, commonly rolls. That's the anterior tibia, tibial ligament.
Flexion.
Three parts, got the anterior tibia ligament as well, posterior. We got the deltoid ligament. This would be a broad, thick band. You would have to be in an inversion injury like this to break it and slide this way. Most people are rolling it downward this way. Yeah. I'm just lightly breaking and the foot. Right over the heel too. How's that? Does it tickle?
Not as bad as the other foot.
Alright, awesome. Let me use a flat surface right here. Lightly scraping. Is it okay?
Yeah.
Okay, sorry. Alright. Caryanne. Awesome. Alright. Now I'm going to put this pillow under your leg and we're going to work on your IT band.
Okay.
And I'm just going to, I'm going to leave this one flowing. Shit. We don't have much time. My bad, there's time. Okay, so we're gonna tuck right there. Tuck right here. Tuck, tuck, tuck. Okay. Didn't last very long. Maybe we just went a little bit longer than we meant to. Alright. And then I'm not digging into it. How is that feeling? Is it okay?
Yeah, that's fine.
I know I'm doing the scraping first. But I'm going to do the massage too.
Okay.
You don't really need that much massage.
Yeah.
Is that okay?
Yeah.
You can scrape before or after massage. Massage before or after scraping. If you have a need for circulation, doing that rapidly would bring blood flow to the area.
Oh, really?
Yeah. You really don't work this area, so you're not going to get a lot of blood flow.
Yeah, sure.
But it's good to bring that circulation here. Alright. Digging into the activa.
What does IT stand for?
Iliotibial band. Goes from the ilium, right where the glute medius attaches into it, and it's a tendinous band, to the tibia. Passing the knee joint to the tibia. That's why you know it's the IT band. When you see IT band, it doesn't say IF band. It doesn't attach to the femur. It runs along the femur. Yeah, so it crosses the hip and the knee. So it's involved in a lot of running long distance, flexion, extension of the knee, and the hip. I'm going to tighten those. Running up and down heels. Miles and miles and miles. Alright. So, how are you feeling, Miss Bailey?
Pretty good.
I mean, Miss Caryanne? You're feeling great?
Yeah.
Miss Caryanne? Okay, great. Awesome. Well, thanks so much. I gotta do your abdomen, but freaking thing just freaking. Oh, hey, Brooke, how are you doing? Good. How are you feeling?
Wonderful.
Awesome. How's the baby? Okay.
Greg, I made birria ramen if you want that.
All right. I want to do the abdomen massage.
Okay.
Okay. Go ahead and turn over. This really is terrible. Absolutely.
Really?
Yeah, because this is not open.
Where'd you get that from?
Target. And they never have it too. It's always sold out.
Alright. Okay. We're going to go ahead and just do this. And then we'll see. We're going to do the abdomen massage. That's really sucks.
Sorry.
It's not your fault. It's not. Okay, cool. So, oh, and I wanted to do the pelvis blocking too. Okay, we're gonna do the pelvis blocking.
Okay.
Because we can do it with the forward, okay?
Okay.
So these are pelvic blocks. It's good for SOT. I'm just gonna put these under your hips, okay?
Okay.
So I'm just gonna put them. Which side of your do you feel like you get more extension? Extension or flexion? More flexion.
Maybe my right side.
Your right side you get more flexion? Okay. So here we're gonna put it under your ilium, okay? So I'm just gonna put these under here. One of them. Is this right under there? Okay, now drop it down. Is that? Do you feel it?
Yeah.
Let me move it up a little more. Okay. How's that? Good. Okay. And then here, because you got more flexion on that side, we put it so that you get more extension. And then on this side, we're gonna put it under here so you can get more flexion. Okay.
Okay.
So this one's gonna be under your ischial tuberosity. The other one we put under your ilium. Okay, go to lay down. I gotta make sure it's on my spine. Okay. Yeah, I'm gonna point this up, okay? How's that? Is that okay?
Yeah.
A little more. Okay, good. Are we good?
Yeah.
Does it feel weird?
No.
Okay, cool. All right, so I'm gonna cover you right here, and we're just gonna do the abdomen massage. I'm gonna have to look like this, though, okay?
Okay.
I'm gonna actually, this is like not how I wanted to do this. Sorry. I'm gonna put this on your eyes too, okay?
Okay.
Some eye pillow. Good. We're just gonna cover your breast tissue. I'm gonna have to have a double chin this whole time. Sorry. All right, and I'm just gonna put it right here. I'm gonna hold it right here, on the shoulder. Just grab the other line, pull it down. Okay, you good?
Yeah.
Make sure you're not exposed to any breast tissue. And then you can put your arms down. And then I'm just going to demonstrate. And that's still under you? Okay, that's under your abdomen.
Yeah.
This is under your shoulder too, because that was where you got more flexion, so we're going to get more extension on the side. And we're going to get more flexion on the side, okay?
Okay.
It's really good for me. So for this, I'm going to demonstrate the abdomen massage from the belly button. You go like this, right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. Right lower quadrant, you can have appendicitis. Signs right here. If there's pain, you can also have a fibroid, a uterine fibroid pain if you're a female. You can have a ureter stone, a bladder stone, working its way through the kidneys on the side as well.
We should just make a bunch of dips then.
And then you can also have Crohn's disease going up. Oh, it's an IBD, irritable bowel disease.
Oh yeah.
And then you go up, you palpate. If there's any pain, you're in the right upper quadrant, right over here. The gallbladder, you would dig under the ribs. Is there any pain? Okay, good. And then it's also the liver, right on here. There could be pain. Hepatic flexure, could be Crohn's disease as well. It could also just be constipation if you feel any lumps. Right in here is the abdominal aorta. Where the head go lightly. If you feel, if you're putting like these fingers apart and you're feeling throbbing equally, that means it's a pretty enlarged abdominal aorta. You can feel it palpating. I don't, so that's good. All right, and then we keep palpating the transverse colon. That could be Crohn's disease, obstruction, abdominal obstruction, gas, pain, diarrhea, constipation. It could also be ulcerative colitis, another irritable bowel disease. We're into the left upper quadrant along the transverse colon. And then here is the pancreas and the stomach. Duodenum under here, by the gallbladder. And then right in here, the spleen. Right there. Splenic flexure of the large intestine. If you have any pain here, it could be an enlarged spleen, which happens after you have an infection, a viral bacterial infection, where it has to destroy all those white blood cells to clean out contaminants. It can also be in diseases such as sickle cell anemia, where it has to destroy all those red blood cells. It could also be from leukemia or trauma just in general, because it cleans out all the old blood cells. A lot of old blood cells. And then it can also be diverticulitis as it goes down into the sigmoid colon. We got the descending colon, sigmoid colon, the splenic flexure. It could be diverticulitis in someone in their 50s who doesn't need a lot of fiber. Those are little pouches on the colon that if rupture, they can cause bleeding. Anywhere in this abdomen is the peritoneal cavity, and it has stretch receptors. So if there's any bleeding or extension, it would be painful. So that could indicate that anywhere. It would be constant painful, especially the movement. Okay, so we're into the sigmoid colon. Sigmoid is shaped like an S, then down to the rectum, deep to that. Below the belly button, we go into the uterine fibroid area. If there's the uterus if it's enlarged from a fibroid, could be endometriosis, either side lower quadrant, ectopic pregnancy, pain referral. It could be distended urine. It could be if it's a male referred, it can also be the ureters here. Ureter stones coming down into the bladder. Bladder is right here, right above the pubic symphysis, pelvis. And then that could also show signs of irritation in a UTI, urinary tract infection, bladder stones. Referred pain from prostate cancer patients or prostatitis in males over 50 usually, and then testicular cancer referred pain can be right in this area as well, and that's in younger kids in their 20s to 30s, that are male, of course. And then ascites. Ascites is a sign of liver. See, this is all Caryanne, but if she had fluid that felt like a waterbed, and you can literally see it move, and then she rolled on her side, and then the ascites, the fluid moved, that would be ascites. And ascites is a sign of liver failure. So you see that. And it might not be painful, but it would show. They would also probably have a lot of venous spider veins as well. That's what they say to look for. And it can be seen in congestive heart failure as well. And cancer too. Yeah. All right. Let's see. Is Brooke looking at the okay, never mind. All right, so we're gonna just palpate lightly. We're gonna do an abdominal massage. Any pain? You don't really need oil for this because you can just use the fat half of your fingers. Oil is really nice though. So I'm just going up, ascending colon, looking for pain, 3 to 12 strokes. Across, transverse colon, looking for pain. Moving, all the digestion goes this way. Descending colon from splenic flexure. Sigmoid colon into the rectum. Across is the pelvic and uterus and referred pain for male reproductive tract if a male. And up, you got the appendix down there. And then up again. And then you can go to the flanks, down to the psoas, up, again, 3 to 12 times. It's good for massaging the weeks of the abdominals. Abdominal weeks. Yeah, good for stimulating digestion. So digestion duodenum right in here. You got the portal tree up to the liver, the liver rib cage. Deep in there, you got the stomach, pancreas, the gallbladder, portal vein, hepatic artery vein. So then in there, the stomach is like a big tube. It actually goes like right in here, across duodenum right here is the top of the jejunum right in there. Gallbladder is right in there, empties out. Enzymes to digest food. If you have any diarrhea or upset stomach or cramping or intense stomach pain, it could be that you have cholecystitis, which is gallstones. And gallstones means you have a problem with fats being digested because the bile is not coming out. And the cholesterol stones, they don't normally show up on an x-ray, but if it's a long-standing calcified tissue damage, it will. The go-to gold standard for diagnostics of any abdominal growth or stone is ultrasound, except for kidney stones because those are mostly calcium. And they're non-invasive. Ultrasound is just sound waves. Yeah, the most invasive is actually CT because it's a 360 X-ray view, so you're exposed to more ionizing radiation. How's it feeling? Is it okay?
Yeah.
And then you can do little circle strokes if you want. Because our colon has different grooves and it holds it in one place while it expands in others. That can be really soothing. Pretty good?
Yeah.
Awesome. And we'll end with a couple of psoas. And then end it. They call it the circle and sun. So clockwise. Pretty neat though, right?
Yeah.
And then you just cover the pillows and you just pull the pillows out magically. How are you feeling? Pretty good?
Yeah.
Let me remove those blocks.
Okay.
And then I just want to see how you feel. I'll get you your shirt too, okay?
Okay.
It's right on the table. Tell us how you feel, okay?
I feel good.
Okay, let's see. Let's see you walk. I got your phone.
Okay.
I'm gonna put it on the table. Okay. Here's your sweater. I'm gonna turn around. Let me know when you're done, okay?
Okay.
Oh, did you guys make food?
I think my mom made cinnamon rolls.
Ooh, awesome. Oh, cool.
Those are not cinnamon.
Oh, really? What were they? Sugar cookies?
No, they're like hot cocoa. There's no cinnamon in
good?
Yeah, you're good.
Caryanne? Alright, Caryanne, let's see you walk around. I just want to see how you feel. Are there any areas that are sore?
No.
Okay, cool. So we put pelvic blocking on you, and then we did an abdominal massage, which is good for stimulating digestion and tracking any abdominal pain you might have. We did instrument-assisted guasha, metal guasha, scraping on your ankle. We checked your deltoid and your ATFL, and we also did it to your IT bands. And those were fine. You're not tender anywhere. And then we also did scraping, cupping, and a hot stone on your back, and then your forearm flexors and extensors. Make sure to stay hydrated. Why don't you go get some water right now?
Okay.
How are you feeling?
I feel good.
All right, great. It'll take me a little while to clean this up, okay?